prior to repackaging. What's the bottom line? Every pharmacy benefit manager, every healthcare provider says that they're transparent, right? Not one will admit that it isn't, but there are different degrees and level of transparency. Level 1 is an imposter, yet 6 out of 10 organizations, this is the level of transparency that they're receiving from their PBM. Level 2, again, imposter. 3 out of 10 organizations are receiving this degree of transparency from their PBM. And then level 3 is the real deal. But unfortunately, only 1 out of 10 organizations, and typically your largest organizations that have pharmacists on staff to manage the pharmacy benefit, receive the highest level of transparency. Negotiating prices or negotiating prescription drug costs based on prices is misleading because, as you now know, prescription drug prices, revenue streams can all be manipulated. Transparency, though, cannot, if you know how to define it. We define transparency as the perpetual elimination of all hidden costs. So what's the number one way to significantly cut prescription drug costs without impacting current benefit levels? That number one way is simply that the PBM must sign as a fiduciary. If that PBM does not or is not willing to sign as fiduciary, first you got to ask yourself why. What are you hiding? And if it doesn't, then it ultimately has the responsibility to act in the best interest first of its shareholders and not